Hey guys, a little over a month ago I posted a video talking about this rash that I have that may or may not be associated with the use of Remicade. I was on Remicade for a very long time, had no issues whatsoever, then all of a sudden I started developing this rash on my leg which turned into something that was all over my body. I went to a dermatologist, they gave me some false readings. I went to a second one for another opinion. I got a biopsy there and it came back that I have psoriasis. And psoriasis is an overproduction of your skin cells. It's another autoimmune disease, and my doctor thinks it may actually be associated with the use of Remicade. In some patients, after a long-term use, and even a relatively short-term use of Remicade, you can develop these rashes and psoriatic-like symptoms. So I've been off of the Remicade for about a couple months. I think December 13th was my last infusion. And the rash itself hasn't changed yet. My doctor said it might take 4 to 5 months before my immune cells kind of turn over and start fresh. But I actually feel like it's kind of getting worse in some ways. And the other problem that really sucks with this condition is in some people you get joint inflammation. And I've definitely been having that. I've been getting swelling in my collarbones. They're really calmed down now because I've been doing some steroid cream and also doing some holistic treatment, taking stuff like curcumin, which is a good anti-inflammatory that's more holistic, and that actually seems to be helping the joint pain itself. But I also have it in my hips, so a lot of like things that I enjoy doing. I'm a very active person. I've been kind of barred from doing them because the pain has been so severe. What I do on my feet in terms of work, I'm on them all day long, so it's really tough with the pain that the joints have been causing. So that's one small issue there that's really been affecting me. But to get back on target with this video and the rashes, I want to show you guys what the situation is right now. I'm going to try and get in some better light than I was in last time, and I'm just going to show you the top of my thigh and how much bigger it is. If you want to watch the first video, the comparison, these are humongous right now. I mean, that's my hand. I would say I probably have an average size hand, and there you go. That's a good comparison of it. All the back of the thigh. I mean, this is definitely like textbook psoriasis, and I thought it was that at first. And because the biopsies from the first dermatologist weren't totally clear, I kind of had some hope that it wasn't. But I mean, it's so obvious now with these disc-shaped rashes. They're flaky, they burn, they swell up a little bit, and they're really just hard to treat. I use some stuff called butt paste, which works like phenomenally well to soothe it if I don't use a steroid cream. But the butt paste is just something I found over the counter. My mom actually got it because she works in a doctor's office, and she told me to try it out, and it works really well. So if you know anybody with psoriasis that doesn't want to take some medicated steroid creams for a little while, I've had the best success with butt paste so far. But my forearm, I want to go back to those original shots. I remember saying this one was like a quarter in circumference over here. It's kind of sunken down and lost that spherical shape, and it's just kind of just a rash now of some sort. But I also got these new ones over here, and I've been off the Remicade, so I'm not really sure the Remicade's causing it. And the Remicade might actually be helping it because Remicade can treat it. So it's just kind of a waiting game, and it really sucks not knowing what the direction is in terms of the doctors. And you know, the worst thing that's happened to me besides this joint pain, which I've had a really hard time accepting, is one of my doctors told me I should go on something called methotrexate, which is a cancer. It's a chemotherapy drug, and although Remicade is like a pretty hardcore immunosuppressant, when your doctor tells you to go to the next step and try just straight up chemotherapy for a new condition that may have been caused by the first drug, you kind of freak out. So coping with that has been emotionally extremely difficult for me, but I'm just kind of hanging on to the hope that maybe it'll go away when I'm off the Remicade, and if it doesn't, hopefully the Remicade will treat it. And if not, possibly some more lifestyle changes. The diet I mentioned in that first video has also been shown to provide some relief for people who have skin conditions. But I really wanted to just post a second video just to give you guys an update. I'll probably post another one next month, see if anything clears up. I'm going to be going on mometasone furoate, which is a steroid cream, to try and calm it down a little bit. And then from there, I'm just going to use lotions, and some topical vitamin D. So for anyone out there that's dealing with this stuff, I'm sorry for you. It is hard to deal with, and I understand. If you have any questions, you want to message me, let me know, and maybe we could talk about it, because this is just a new condition for me. It's totally different than what I'm used to with the poopies associated with ulcerative colitis. So maybe we could learn a little bit from each other. Best of luck to you guys, and I hope you all stay well. Bye-bye.